From the studios of KENW on the campus of Eastern New Mexico University, it's You Should Know, featuring the people and events of Eastern New Mexico and West Texas.
Welcome to You Should Know. I'm Evelyn Ledbetter, your host, and my guest today is Cristy Walsh, and she's a women's health care provider in Portales, New Mexico. Cristy, thank you for taking time to join us today. Really appreciate it.
Well, thank you for having me.
Oh, for sure. There's so much to learn.
Yes, there is.
Lots to cover. So if you don't mind, let's just start. Just tell us a little bit about yourself.
Okay. Well, I am a native of Portales and graduated high school here and then went on to nursing school. Knew that's what I always wanted to do and was able to teach at Clovis Community College in the nursing program about 4 years. And then that led to my master's in nurse practitioner. And I became a family nurse practitioner first.
Okay.
So I was in family practice for about 6 years and then really enjoyed women's health.
That was your calling.
Absolutely. So I went on to become a certified nurse midwife so that I could include the pregnant women, deliveries, and later specialized with a women's health clinic in Clovis. Was there for 23 years, specializing in women's health.
Well, you're the one person, you're my provider, and you're the only provider that I've had the continuity with that actually knows me as a person, and because you've been that same place for so long, and lots of acronyms. So the nurse practitioner was not real common. How did you learn about that?
At the time when I became a nurse practitioner, I was going to West Texas A&M and their master's program, planned to do nursing education, and they started the nurse practitioner program. So I was one of the first graduates of the family nurse practitioner program at WT. And then later went on to become a certified nurse midwife. But when I first came back to Portales, there wasn't very many advanced practice nurses. So it was a new thing. Now, many of your primary care providers are advanced practice.
Exactly. Mm-hmm. It's came a long ways, and I know with through rural communities, especially we have lots of them in New Mexico, it's hard to recruit doctors here, and then also your reimbursements through insurance, and the nurse practitioner was another way to get health care
to the rural
communities.
Absolutely.
Okay.
It has filled a need out in our rural communities when you have very few physicians that want to come practice in small communities, unfortunately.
And you're currently at Roosevelt General, Women's Health. Mm-hmm. Prior to that, Women's Medical Center
in Clovis.
And when that was primarily the place that provided health care during pregnancies and things. And it went away because
of trouble recruiting physicians retiring, and we lost our beloved Dr. Cross, who passed away 2 years ago, and that left a big void at Women's Medical, and it was difficult to recruit. Women's Medical Center covered a wide area. It was a regional center for women's health. So it covered from Tucumcari, Muleshoe, down to Elida, Kenna, Fort Sumner. Portales covered a big area. And we lost that. And even though it's trying to be rebuilt, it's not there yet.
That void is there. I mean, obviously, New Mexico is so diverse, and also West Texas. Albuquerque, Las Cruces, Santa Fe, you have providers, but out in all these rural communities, it's very tough. So,
very difficult.
So we're so fortunate that you're in our area and other places in New Mexico that are able to have that same thing. So, so you've kind of talked about your training and your education. Well, you've been doing this for a lot of years. You can never retire. After I die, you can retire.
So it'll be a few years.
I hope so. Well, there's probably, and you tell me, the segments of our life on women's health, 3 pretty separate age groups, I think.
Absolutely, and there's so many issues that are significant to just women. We have certain issues that are so different than men. So it makes it challenging at times. And there's different phases of our life where we need different care, from
Okay.
starting in our teenage years, from that first menstrual period, all the way through postmenopause
Okay.
and the issues.
So when should women or young ladies, when do they need to start seeing a women's health care provider versus a pediatrician?
The first GYN exam really should come by the age of 21, for sure, with the first pap smear. However, there's times that pediatricians refer to the women's health practitioner when there's problems with their periods or they're having hormone issues and things that young girls face. Those would be reasons to see them sooner
Okay.
if it's not something that they feel they can handle.
Okay. And actually go to someone that is specialized and trained in dealing with those issues versus a pediatrician
Yes,
who is more on early childhood.
right.
Okay.
However, if a woman becomes sexually active before the age of 21, they should seek the annual care with the women's health practitioner.
So a couple of the screening tests that most people are so familiar with all through their lives is the pap smear and also the mammogram. Will you talk about that on a little bit, what those are?
Yes. And like I said, the pap smear screening starts at the age of 21. That just screens for cervical cancer. And along with that, you can do STI testing, which is sexually transmitted infections at that time too, if needed. That is done every 3 years. And now with our new pap smear testing, they also test for HPV along with it. And that is the most common cause of cervical cancer, is HPV.
And most people may not be familiar what that acronym is or what that actually is. Can you tell me a little bit?
It stands for the human papillomavirus, and HPV. So it's hard to say, so I'm going to call it HPV.
Yes, please.
HPV is a virus that you do come in contact with when you're sexually active if you or your partner have had more than one partner. And like I said, it is the number one cause. Certain types of the HPV are more common for cervical cancer. So pap smears now can be done every 3 years if you're negative for HPV. However, if it tests positive, you stay on an annual schedule.
Active surveillance.
Yes.
And watch that.
Absolutely.
So the vaccine, there actually is a vaccine for that. What age do young women get that?
The recommended age, it can start as early as 9. From 9 to 26 is when it's recommended. And I did look up on the MD Anderson cancer site that it's most effective when given between 11 and 12 years of age because it builds that immunity.
Okay.
It is the first vaccine that protects against a type of cancer.
Isn't that amazing?
Absolutely. There's no other vaccine that protects against a type of cancer. So it's important to talk to your pediatricians, parents to talk about getting the HPV vaccine.
Have those conversations.
Absolutely.
And for parents to be aware of what their treatments need to be for their young girls.
And I know that it's a difficult decision, but I think seeing the data and knowing how much we have prevented with cervical cancer since the Gardasil vaccine came out is amazing.
That's the advances in medicine are amazing.
Yes.
And the things you can help prevent. And so that's, you said 9 to 12?
Between the age of 9 and 26.
Okay.
And then between 26 and 45, it can still be given under certain circumstances when maybe change in marriage, new partner, or you just feel this person is more at risk.
Okay.
Even if they've already tested positive for HPV, it can be beneficial. Over the age of 45, it's not really shown in studies to be that much of a influence on
So
HPV.
a personal choice, and on these things, that's the thing, to actually talk to your provider.
Absolutely.
And get their recommendation on what's going on with you personally, because we're all different. We're not a cookie cutter human being.
No, we're not. And we all have different risk factors.
Okay. And other things for the young years? So as you advance from going into a young woman, and things you can do to stay healthy, planning at some point in the future, you may want to start a family. So the STIs, that can have an impact on fertility later on if it's not monitored and screened.
Yes, it's a good idea once you become sexually active to establish with a women's health care practitioner so that you can talk about those preventative. Think ahead. If you plan, may not be in the next year or even the next 10 years, but it's good to start planning towards when you want to start a family. Do annual STI screening.
Okay.
Also, menstrual problems, hormonal problems, obesity, endometriosis. There's so many things that can influence fertility. And so talking to your healthcare provider. Yes.
That's such a personal choice as women when we choose to have a family and when it's right in our life.
Sure.
And also you want to be healthy and prepare for that. So again, talk to your provider and find out and do what's right for you as an individual.
Absolutely.
Okay. So early years, and that may be also a time that young women may begin asking questions on birth control and things. And that's something that I'm sure you have discussions with. And
it's a common visit with me. And the good thing now is we have a lot of choices, and we have a lot of safe and effective choices. Lower hormone doses, from birth control pills that we're kind of all familiar with, to IUDs, to the contraceptive ring, patches. And then there's just natural family planning for some people.
Okay.
And I think talking to your provider to really understand that better. And now with our smartphones, we can download good apps that track our menstrual periods and ovulation, and that's been very helpful.
Well, we all have different cultural backgrounds and religious backgrounds, so trying to find that fit with a provider that will be commiserative or understanding of what's best for you is a very big part.
To individualize that care.
Exactly. So then moving on into the mid-years. So you've chose, you're to a point you want to possibly think about starting a family. Things you can do, vitamins or things you can start taking that are helpful.
And first of all, it is good to track those menstrual periods on a menstrual tracker so that you can plan ovulation. And a good year before you start to plan pregnancy, it's good to be on a prenatal vitamin that has folate or folic acid in it. That's a recommendation. Healthy diet, healthy weight going into pregnancy certainly helps prevention of gestational diabetes, preeclampsia, and other problems that come with pregnancy. So it's good to be planning that ahead of time.
Get that body as healthy as it could be before the pregnancy.
And unfortunately, infertility is on the rise in our country. And I think a lot of that is from unhealthy lifestyles and obesity, menstrual problems. So the more proactive we can be, the better the chances are. However, even under normal circumstances, it can take up to a year. We in the healthcare profession don't consider it an infertility problem until you have tried at least 1 year without any contraception of planning pregnancy and haven't achieved pregnancy before we consider that a problem. However, that doesn't mean that you shouldn't kind of start a workup earlier to kind of prepare.
I have a friend, and it was odd. She was mid-30s. That was her first pregnancy, and she was referred to as geriatric. And she said, "I'm not geriatric." But where is that range that all of a sudden you become more at risk?
We consider it a higher risk over the age of 36. Okay. So you may get called that. And I don't like that term either.
It makes you kind of just
cringe a little bit.
Cringe a lot.
But there are certain things that we look for in the healthcare field that put you at greater risk after that age.
Okay. So definitely prepare and give some thought to that before you get going.
Yes.
So maintain that well-being during those early years. And, this is a tough group. So I guess it's individualized of when each person may decide if they're concerned about not becoming pregnant and coming to see a provider to say, when should I be concerned? And you said a year.
A year is when it's really considered a problem. However, statistically, under normal circumstances, after 6 months of trying, around 50% of women will become pregnant. That's only half. That's the way we look at it. So I say between 6 and 9 months of trying and you haven't achieved pregnancy, maybe it's time to start looking at labs, see if there's a hormonal issue, ovulation problem, and your partner too, to test, have him tested.
It's true. It's not always just, obviously, it's a
Right.
50-50 chance it may be the male as opposed to the female on that.
Yeah.
So just having those open conversations is huge. And for those years, so you've achieved, for us and in rural communities, where are most pregnancies anymore? I don't know that you have the same doctor all the way through pregnancy, all the way through childbirth.
Well, and it's difficult because that would require a physician being on call all the time, and that's not realistic. And so, yes, they do rotate call. And in our area here, Clovis PRMC Hospital Presbyterian is working on rebuilding an OB program. Right now, I think many of our patients travel to Lubbock, Amarillo, or Roswell to deliver.
And that's scary. I know when you've not had a baby and you don't know what's coming for sure, the thought of driving 100 miles
It's scary.
is when you're about to deliver is scary and very overwhelming.
Yes.
So rural health, it's tough.
It is tough. And I think we're going to see more and more rural hospitals dropping OB services. And that's a scary thing for the future of medicine.
And again, as strong as Women's Medical Center was, and you couldn't recruit people into a rural area to keep, and it was a big practice. And how sad to lose that.
Yes.
It's hard to get it in any rural area.
Yes, it is. And Women's Medical Center had been there for 30 years. And so to see that leave was difficult.
A very huge thing. So again, we're fortunate to have you in our area. But again, the whole state, we're dealing with trying to focus on how to get people in here. So, and then there's all the things in those middle years. You've achieved a pregnancy, maybe you've got a child or two. You're also dealing with possibly elder care for your parents and a career.
Yes. You're kind of in that sandwich period of your life where you've got small children and aging parents, and you're busy in your career, and a lot of pressures on women in those middle years, a lot of stressors. I think that's when I start to see so many women with what they feel are hormone issues, a lot of fatigue, low energy. And a lot of that comes from our lifestyles. We're so busy and we take on so many roles.
Sure.
But there can be underlying issues, or there can be some things that could help you get through those years. So I think those are reasons to talk to your providers.
Well, the anxiety and the concerns of raising a family, and like I said, dealing with your parents and work. And so when you start feeling like you're getting a little out of control and going upside down, don't wait. Go talk to someone. There's help out there.
Absolutely.
Because you treat the emotional part, not just the physical part of a female.
Yes.
Which is huge.
It is huge. And it's a big part of our health.
It is. If our mind's not in a good spot, the rest of us, and we can't be the best mothers or the best partners if we're not in a good spot in our life. So
and that's what happens when we take on so many roles. You kind of get to a point you don't feel like you're doing good at any of it.
You're just halfway. You're halfway doing all of them.
Absolutely.
Okay.
So it begins to affect our health. And then early menopause, and menopause hits, and that makes it, you're adding hormone issues to a lot of stress that we're already under. And those are challenging years.
So tell me this, when does menopause end?
Well, first let's talk about when it begins. The average age of menopause is 50. So 45 to 55 is the range when a woman finally stops having periods, the ovaries are done, and they no longer have that hormone.
Okay.
Your natural hormones. True menopause is after you've made it 1 year without a menstrual cycle. The menopausal period is more the symptoms we deal with. The hot flashes, night sweats. There's so many vaginal dryness. Our skin, hair, and nails change. There's lots of things women go through. Fatigue, low energy. And the list kind of goes on and on. There's a lot of things that can happen during that time. And that's a time to start talking about hormone replacement. Sometimes it's just for symptoms, but then we also have to remember that at the time of menopause and no hormone therapy, there's also new health concerns that we're starting to screen for, including osteoporosis, heart disease. It becomes much higher after menopause, diabetes, Alzheimer's for women.
Mm.
There's a lot of conditions that we start to focus on.
Those
after
golden
that.
years don't sound so good.
Well, the good thing is there is help, and and learning a healthy lifestyle, and whether hormone therapy may be right for you. That's a conversation you should have with your healthcare providers.
Because some of those things, I know there's interactions or things, if you are on hormone replacement, if you have a family history of breast cancer, does that play into it?
It's a conversation you should have
Okay.
with your provider. However, we know studies show that estrogen does not cause breast cancer, but it can make one grow faster if there's a cell there that feeds off
Okay.
of it. So it's more one that can feed a breast cancer, not cause it. So it's a conversation that you should have, weighing the risk and benefit. And if you have a strong family history of breast cancer, maybe doing genetic testing. The BRCA testing for women, genetic testing might be appropriate for you if you talk to your provider to see if you're a carrier of the gene.
I think it's interesting. I know through some of the healthcare programs that were put in place, certain screenings and testings, an annual exam is typically covered 100% by insurance. But then there's other things. I know there's a good test for ovarian cancer, but that's not something that's typically covered
Not
under your insurance. But at the same time, is it worth paying that money out of your pocket if you can prevent that?
Right. And I think you're referring to the CA-125. It's a blood test that's
Okay.
an ovarian cancer screening test. And there's certain situations when insurance will pay for it under certain conditions. So that's something to look into with your provider if that's needed. It brings up another point, though. Even though the actual pap smear is every 3 years, you still should see your provider every year. A clinical breast exam
Okay.
is recommended yearly, and then a pelvic exam. That's one way to assess the ovaries,
Let's
is
see
through
what's
your
going on.
pelvic exam that your provider. So even though you may not be collecting the cervical cancer screening test, there's so many other things we look at in the annual exam.
And mammograms at that point in your life, when do they start?
Good question. They now are recommending between the age of 40 and 45. Earlier, if you do have a strong family history or have had any problems. And then in your 40s, it can be done every 1 to 2 years. After the age of 50, every year. Because the biggest risk factor for breast cancer is age. The older we get, the more at risk we are for breast cancer. So it's something we should start to screen for every year.
And when we've talked before, you told me, is it 1 out of 8 women will
Once you reach the age of 80. Yes.
Oh, okay. Okay.
1 in 8 women at the age of 80 will develop breast cancer. So the risks are high.
So you continue screening this it's well into later years of life.
As long as you feel that it would impact your health. Absolutely.
Sure. There's so much to cover on that. And then, there's things that we get into as you get older. You may be the caregiver to a significant other or vice versa. So you get into that. Just so many things that influence your world.
And I think we've just
scratched
the surface.
So at least continue to get those exams. And then as you get older, the osteoporosis, testing for osteopenia, there's medicines you can give.
Yes.
The pap smears, the mammograms, and talking with a provider that you trust.
Absolutely.
Okay. Other things you want to touch on?
I think that's it. Bone density testing for those osteoporosis usually starts at the age of 65.
Okay.
And should be done every 2 to 5 years.
And do that.
That's one thing we didn't mention.
Sure. And again, continue on with testing on diabetes and heart health.
Thyroid.
Yeah.
So getting your annual lab tests, important part of that screening.
And when you were talking about, even though you may not be having the physical part of the exam so much as the pap smears and things, but just that conversation in your labs and monitoring those to make sure you're staying in a healthy state.
Yes.
So if I ever get those grandbabies, or when people do, they want to be healthy and be able to enjoy that part of their life as
Absolutely.
well.
Absolutely.
So, recommendations for people in rural communities of how to come up with a provider, or
Well, obviously, start with your primary care provider. So many of them do the same things the women healthcare practitioner does with the screening, in relation to the screening, and then they know when you should be referred to a specialist in women's health.
okay. You know, Cristy, like you said, there's so much, but find your provider, find someone you trust, and has your best interest. They truly know you, and work with them.
Absolutely.
So, I was going through this. We could keep covering a lot of things and dig in deep,
Yes.
but again, just wanted to say thank you for you being here and taking the time to join us, and find your person that's going to take care of you. So
Yes.
thank you very much. So to all of you out there, thank you for watching, and we'll see you next time. Cheers.